Thank you so much for joining us here on Idaho Today. You know, many of us experience minor joint pain. You know, our knees or our hips creak and hurt. But if it's uncomfortable to do normal tasks like walking, getting dressed, or getting out of your car, you may want to consider new treatment options. We visited Dr. Taylor Lara. He's an orthopedic surgeon at St. Alphonsus to talk about surgical and non-surgical treatment for these aches and pains so you can move easier and live your best life. Dr. Lara, let's talk about joint replacement. So who's a good candidate and what type of conditions lead to joint replacement?
Okay, the best candidates for joint replacement, and speaking specifically of hip and knee arthroplasty or total joint replacement, are patients that have severe arthritis of the hip or the knee, and patients that have severe findings of this on x-ray, have pain every day with every step, and have pain that limit their activities of healthful daily living. They tend to do the best with total joint replacements.
And as we're seeing our population age, are you seeing an increased need for knee and hip replacements?
Absolutely. And that's mostly the fact that we have an aging population and a growing population. And the number one risk factor for developing osteoarthritis is age, in addition to genetics. Unfortunately, we also do have an obesity problem, and that can compound both the symptoms and the progression of osteoarthritis. But we're definitely seeing increasing demand, and it's keeping us very busy.
And let's talk about technology too. How has that impacted these procedures and the improvements that you've seen from it?
Well, one of the best innovations in total joint replacement that nobody would argue with is that some of the components are much more durable now. This has been around for a while now, but hips that were done 20 years ago or 30 years ago, we were really worried about them wearing out, and they could lead to very complex revision surgeries that have to be done if the hip did wear out. I think what's been the best innovations recently is not necessarily very high tech, but the way we take care of our patients in collaborating with other teams, including our anesthesiologists, our nursing and physical therapists at the hospital, and our use of what we call a multimodal pain control regimen, using multiple different medications and anesthetic strategies to reduce post-surgical pain, and avoiding using opioid medications, which we all know have some negative side effects. And that's allowed us to help people recover much faster in joint replacement surgery, and 80% of our patients are going home the same day.
Oh, wow.
As a result of that.
Really? Okay.
Absolutely, yeah.
And so how long would you say recovery would be from knee to hip replacement?
Well, the hip replacement typically has a more predictable recovery and a slightly faster recovery. There's a wide range of normal for everyone. I usually tell people expect to be feeling better than before surgery, roughly 2 to 6 weeks after hip replacement. You can usually safely bet on that. And for knee replacement, there's a higher variability. I tell people to expect between 6 and 12 weeks after the surgery to be feeling better than before surgery, but still expect some pain, some swelling for 3 to 6 months after that surgery.
And with the advancements in technology, like you had mentioned, the improvement with the material, should people still plan on possibly having a secondary replacement, or is it likely that they won't need one because things have improved?
People will still need revision surgeries, and we're seeing a growth of that, but not for parts wearing out. It's for other reasons. You know, infection is a concern, fracturing around components, developing instability, and problems like that. Those can all require additional surgeries, but surgeries for components wearing out and the problems associated with that are much, much lower. So about 1% of total joints of the hip and knee get revised every year. So it's a small number, but when you add up the hundreds of thousands of procedures that are done every year, we're seeing more and more of it, but usually not for wearing out anymore.
And if somebody has knee or hip pain, just joint pain, should they go see their provider, or should they come to a specialist like you?
I think either one is a good option. Most primary care physicians are really well trained in identifying, diagnosing, and starting the initial non-operative treatment of hip and knee osteoarthritis. I think it's really important to get a plain x-ray. Fancy scans like CT scans and MRIs often don't give me the kind of information that I want to get, that I get out of a nice plain x-ray. So that's always a great place to start, and it can rule out a lot of things.
Great. And surgery sometimes isn't the answer, right? There's other preventative ways to treat hip and knee pain, or just joint pain in general.
Absolutely. We have what we like to refer to as a ladder of therapy. For a lot of people, that starts with using non-steroidal anti-inflammatories like ibuprofen or naproxen. That's not safe for everybody to take, so I would make sure you haven't been given medical advice not to take those. but those are really good medications for controlling pain. Keeping a good activity level. Weight-bearing activity is generally good for your joints. Many people are concerned they'll be doing damage to their joints by keeping up that activity, and I tell them for the most part that's not going to be the case, and it actually can make the joints feel better.
Wow.
We still do prescribe some physical therapy in certain patients, especially if they have mild hip or knee arthritis. And in some cases we'll consider injections and bracing or the use of gait aids if needed. And all those are things that we try before we try surgery too.
Already gave some great advice, but if people want to learn more about options for them, what do they do?
We have a website that they can visit, and there's a lot of good information, and you can make an appointment with us, or we can help you get connected with a primary care physician.
Great, thank you so much.
All right, thank you.